Hello everyone, my name is Casey and I am a physical therapist that works on the ortho floor of the hospital. I will be going over some information about what you should expect during your hospital stay and rehab after your joint replacement. These are a few of the topics we will be discussing. Preparing yourself mentally is a big part of the process. We encourage you to ask questions in order to understand what is happening next and your role throughout the recovery process. It is important to know what your expectations are and what you should be expecting of us. Having a reliable support coach is very important. Hopefully you have a friend or family member watching this pre-op presentation with you right now. It is also important for your support coach to be present the day of surgery and early in the morning the day after surgery. They will be trained on how to safely provide assistance to you initially post-surgery with mobility, self-care, meal preparation, exercises, and more. They will also be assisting in driving you to rehab if needed, to all follow-up medical appointments, and to outpatient physical therapy appointments. A big thing you can do right now to have a successful transition home after surgery is to prepare your house. Look around your house today and ask yourself, how easy is it to get around now? What is the most accessible entrance? The entrance with the least amount of steps and with handrails is preferable. Work on decluttering your living space. Remove all area rugs and trip hazards. Think about your dining room chairs. A higher chair with armrests is easiest to stand up from after surgery. Can you coordinate a main level setup, or will you need to perform a full flight of stairs to your bedroom? Also declutter your bedroom and make a clear pathway to the door. Having a night light for bathroom trips is a good idea. Remove all rugs from the bathroom as well and think about the safest shower setup. Having a tub bench or shower seat initially after surgery is the safest option. Lastly, think about how wide the doorways are at home. Sometimes older homes have more narrow doorways that a walker may not fit through. We can practice with you going in sideways if needed. Our goal during your hospital stay is to practice all aspects of functional mobility with you prior to discharge. Preparing yourself physically for a joint replacement is also important. It is never too late to start exercising by performing daily walking, chair exercises, and upper body exercises. You can also get a head start on performing your post-op exercises today. These are the exercises that you can expect to perform after your joint replacement. These are all gentle exercises to begin progressing your range of motion and strength after surgery. These exercises are listed in your hospital pathway for your reference. You can expect to stay in the hospital for 0 to 1 day after surgery. Your length of stay is based on the doctor's recommendation with how you are progressing medically and on the therapist's recommendation based on your functional progress. You will be working with an occupational therapist once per day and a physical therapist twice per day in order to meet your goals. You can bring with you to the hospital supportive tennis shoes, loose-fitting clothing, a robe, and your personal walker if you already own one. We will double-check that the walker is correctly fitted for your height. Your physical therapist will order a 2-wheeled walker for you during your hospital stay if you do not already own one. If you don't have a walker, you do not need to purchase one before surgery. During your treatment sessions with physical therapy, we will help you get in and out of bed, start your exercise program, fit your walker, practice walking a household distance, negotiate any stairs that you need to do at home, and perform a car transfer. Your occupational therapist will help you perform activities of daily living, such as bathing, grooming, and dressing. Now we will go over a few do's and don'ts after surgery. You don't want to sit in a dependent position, meaning with your legs down or below the level of your heart for more than about 30 minutes or how long it would take to eat a meal. You do want to elevate and ice your leg frequently in order to reduce pain and swelling. You don't want to place a pillow under your affected knee. You do want to place a pillow under your calf in order to allow for full extension of your knee. You don't want to cross your legs. Keeping your knee in a neutral position will avoid any increased pain with twisting and allow for optimal healing at your incision site. You do want to choose a chair with armrests and place a pillow or cushion to raise the seat height to make standing up easier after surgery and to avoid increased pain. You don't want to pull up on your walker when performing sit-to-stand transfers. Always have at least one hand on the armrest of the chair for safety when standing up or sitting down. When performing stairs, the correct sequence is to go up with the good side or non-operative leg and down with the bad side or operative leg. You will not damage your surgery if you do it the opposite way. It may just be more painful. Your physical therapy goals during your hospital stay are to safely perform all the tasks you will need to do at home, like getting in and out of bed, standing up from a chair, walking a household distance with a walker, practicing any stairs you have at home, getting in and out of a car, and verbalizing any precautions you have after surgery. We will work to progress your knee range of motion to 90 degrees of flexion and 0 degrees of extension. Your occupational therapy goals include completing your activities of daily living, such as lower body dressing and toilet transfers. Your therapist will help you progress your level of mobility and function with each treatment session to meet these goals. You will also have a case manager during your hospital stay in order to help coordinate a discharge plan. The two options for discharge are either going home with your support coach or going to a subacute rehab facility. Our goal is to have you return home after your joint replacement. Several studies show that patients have fewer readmissions, fewer ER visits, and fewer complications if discharged home rather than to a rehab facility. Where you will discharge to after your joint replacement will depend on your family support and your progress in therapy. For example, if you have a family member or friend available to assist at home as needed the first few days, and you can perform all mobility at a supervision level, then you could safely discharge home. But if you do not have consistent help at home and are having difficulty standing up from a chair, then you likely would benefit from getting more therapy at a subacute rehab facility before going home. After discharging from the hospital, you will continue with physical therapy either in the home health setting or outpatient setting. Everyone will transition to outpatient physical therapy no later than 2 weeks post-op, regardless of discharge location. We encourage you to schedule your outpatient physical therapy appointment prior to your surgery. This will ensure your preferred clinic will have an appointment available for you at the appropriate time. You should schedule your first appointment for no later than 2 weeks after your surgery date. Selecting the right outpatient physical therapy facility is based on location, transportation, and ease of access to the facility. You can expect to use a two-wheeled walker for at least 2 weeks after your surgery. Patients commonly transition to a cane and then progress to independent ambulation. Your outpatient physical therapist will assist you in determining when you are safe to do so. Long-term expectations after joint replacement are that you may still experience some pain, swelling, and joint stiffness up to 1 year post-op. This is why it is so important to continue with ice, elevation, and your exercise program even months after your surgery. Your outpatient physical therapy goals are to work on returning to higher level functioning and independence with all mobility. Your physical therapist will assist in managing soft tissue pain and inflammation, progress range of motion, discontinue use of assistive device, improve balance, progress strength, and begin to progress toward work and leisure activities. These are all the Michigan Medicine outpatient physical therapy clinic locations available to you. Thank you for choosing Michigan Medicine, and we look forward to working with you after your surgery.